Premier Mabuyane, thank you very much for your time. Can you hear me clearly? Xoli speaking.
Yes, Xoli, I can hear you very well.
Fantastic. Premier, thank you very much for making this time to speak to us. Perhaps let's deal first with this issue where you seem to be employing the same language that is coming from KwaZulu-Natal in as far as COVID-19 corruption is concerned. Your province was among those that had people arrested. I've noted that you said that you are still awaiting a final report from the SIU, which has been dealing with this. But talk to us about the language that you are using, Premier. Arrest to prosecute. Do not arrest only to make investigations later. Where is this frustration coming from?
Well, from our side, Xoli, thank you very much, and greetings to your viewers. From our side is the experience of having cases of people who are dragging very long, sometimes unnecessarily. Our belief is that most cases have been there for years. If you look at the issue situation, some are dating as far back as 2010. So we believe that a case that would have been investigated from 2010 or beyond that would be a case that can be easily prosecuted. So we would want just to implore NPA as well as the law enforcement agencies at large to ensure that at that point, because this really disorganizes people's lives. Sometimes people are really put aside because of what the organization has said on renewal, only to realize that it takes longer. And it actually discredits work that is being done by our law enforcement agencies. So that's why we really want to appeal. But on this case, a lot has been said about Eastern Cape on the PPE issues. We thought it would be very easy when the SIU comes here to pick up on those issues, bring them. If there was any law broken or if there were any procurement procedures undermined, we have met with them, we have raised the same point, and what they wanted to take us through on the processes they are following. It's them who must finish the report. We are not going to be commenting on the half-cooked reports. We have said that they must do reports and report to President as they do, and take us on board. So, but we can't be acting on interim reports. They must say that it's final report. And then that report must help us to chart the next way forward. So we are raising that issue simply because of those such kind of experiences. We have made our government, every department, every municipality to understand that the law enforcement agencies are here. They are here to investigate allegations that have been made by our people, cooperate, give every information that we have. Even individuals that are out there that might be saying this or that about government on any issues of perceived corruption, take that information. The problem that we have are people who make perceived corruption a reality. So when people are investigating, things are turning otherwise. So, but we are saying, let's give the recognition where it is due. Don't taint the image of law enforcement agencies, drag them into politics. Work flat out, take out, unearth all these issues, go public, raise these issues for public to understand what are you dealing with.
Yes, Premier, perhaps last point on the issue of corruption. It may not necessarily be COVID related this time around, but it has to do with someone who was close enough to you to be the special advisor in your office. And you have made the call that law enforcement must deal with corruption, and I quote, earnestly. This person who was a special advisor to you, when they were arrested, was this a disappointment to you? And when you say deal with corruption earnestly, what does that mean in as far as his case is concerned?
Indeed, that was a setback, but we are happy that the law enforcement agencies arrived at that. If he has got a case to answer, he must answer. Remember, he was appointed when he had no case before him, when he was not charged. So he had to be appointed, and we have said after the case, after his appearance in court, that we will give him a special leave so that he attends to that, and he's following the other internal organizational process, appearing before the integrity commissions, etc. But we can't comment on cases that are before the courts of law. So we've got to be actually quite careful about that because he has got a platform now to answer for any allegations that have been put before him.
All right. Let's move then, Premier, to the issue of the conflicting reports. You seem to have harsh words for Dr. Pillay, whom you say is serving on the advisory panel in the Eastern Cape province. This is the COVID advisory panel. He is suggesting that healthcare facilities there are full up, whereas the advisor in your office, your current advisor, Dr. Mbengashe, who was the HOD of Health not so long ago, he's saying, no, that is not the case. Who must we believe?
We must believe what government says, because it is based on the factual reports, and that includes the epidemiological reports that are being generated daily. We have Dr. Pillay as part of our panel of experts that are advising us on the COVID-19. He's not a doctor in any hospital there. He's not managing, he's not a CEO. If there's anything, he has got a platform to raise such issues so that we can easily make a follow-up if we are given wrong information. But from where we are, I've done some site visit myself. I've seen this. I was speaking to Dr. Kamlashe of Livingston myself yesterday on same issues. He assured me, he gave me details of what is going on. The issue you have will be your congestion at your casualty and in processing patients to wards. In the wards there, we do have decanted beds, the COVID-19 beds that we have set aside for our patients, and they are not fully occupied. We still have spaces. That's why we have been encouraging people in Nelson Mandela that those with comorbidities must admit themselves in our field hospital, Volkswagen, Dr. Mabuyane Field Hospital. They must admit themselves there because we don't want them. We've seen problems of people who stay at home having tested positive. They lose oxygen, it goes down, they've got more complications. They go to hospital when hospital can no longer do anything to help them. They go to ICU, stay longer in ICU. Now we are saying the early detection of the virus in our people must help us to try our level best to deal with any further consequences or any repercussions that might be experienced from them having their health deteriorating. So the field hospital has never been fully occupied. It has always been less than 500. We have got about 1,500 beds. Working with Volkswagen again, we are doing more oxygenated beds so that we have got more supply of oxygen to our people. So this issue of creating an impression that the system is collapsing and something is going completely wrong, there's something funny about that. But it's something that I'm taking it up and making a follow-up, because Dr. Pillay is part of our provincial command council. These reports that we're talking about are presented in that platform. He has a right to share any ideas he has. If he has visited any clinic or hospital, raise such kind of issues so that we attend. We appointed him simply because we wanted people of his caliber to help us deal effectively and efficiently with COVID-19 in our province.
Premier, but final point on this particular issue of the healthcare system. And you'll tell me if this is too much to ask of you. It's a yes or no answer, Premier. Is your healthcare system once again experiencing pressure with this resurgence?
You will agree with me, Xoli. There is no healthcare system, even the most advanced healthcare systems in the world are battling with COVID-19. They are struggling with COVID-19. We are not different as this province from that. But the issue that we're saying, we are trying our level best. When we were starting dealing with COVID-19 from March, we took a conscious decision as provincial government that we're not going to build a field hospital anywhere. We rather have legacy on this, build capacity in our current existing healthcare infrastructure. You know, our hospitals have been dilapidating, particularly in the former Transkei. Most of them are more than 100 years. They've been built through the mud kind of infrastructure. So we have reworked, we have added many beds in response to this. We have added more capacity. If you talk about oxygen, we have now moved into the bulk oxygen tanks to supply almost all our district hospitals. It's no longer an issue of regional hospital. So this is work that we have done. to a larger extent, yes, the answer, of course, will be relative because no one is perfect on this. We are grappling with this. As long as we don't have any vaccine, it will keep on being a problem.
Yeah.
If you talk about Eastern Cape now, probably as I've indicated earlier, the challenge we have, many people of Eastern Cape are living dual life. They are in Cape Town, they are in Johannesburg, they are all over the country. They are now coming back in numbers, leaving those best health facilities you have in big cities.
Yeah.
And those big cities have got privilege of not only public healthcare systems, but also private investment in their spaces.
Yeah.
So this is one thing that we've raised it here, that we'll be looking at it, open up that market, allow people, we do have a market. Many people are working for government, they've got medical aids here. We should be having more private hospitals here that should help and really increase capacity of government to give a better, proper service to our people.
Yeah.
So to answer your question, the health system will forever be failing. If you talk about the road accident, fatalities that are happening, all these people are putting pressure in our trauma care units in hospitals. When you are busy dealing with this, there are other things that we can manage and control.
Yes.
But out of recklessness, people are not taking responsibility. People are not following the rules and regulations that are out there. Even COVID, it has been proven scientifically that the non-pharmaceutical interventions are helping a lot to fundamentally disrupt the transmission,
Yes.
the transmission of this COVID-19. So we are appealing to our people. We should not be having our hospitals. We should really think about those frontline workers who are also susceptible to the virus, just like police and soldiers. In the Eastern Cape, we have lost more than 26 police officers who are busy trying to enforce rules and regulations to people who are not prepared. Some of them are intervened. And these people are also loved ones in families. People are losing their fathers, their brothers, their mothers who are policemen and women. Simply because people don't want to take responsibility. People want to go to taverns at a point when we're at war. We're dealing with our common enemy. With those who are in taverns and everywhere must be COVID-19. And people must understand and think about those who sacrifice their lives in order to save more lives.
Premier, I'm glad as part of your response in this question I've just asked you, you touched on the issue of the people of the Eastern Cape who work in big cities, who are now going back into Eastern Cape. Yours is a vastly rural area, and these people are being transported in all manner of public transport vehicles. Is there any support that your province is giving to the taxis and buses which are going to be ferrying most of these people who are returning to your province?
Not really. Remember, this is also regulated through the National Command Council, National Coronavirus Command Council. Taxis are expected to follow certain protocols, just like buses. So we expect people to respect lives of people in whatever that they are doing. I think there were a lot of interventions that were meant to mitigate the economic challenges that were felt by the taxi people. So we really appeal to our taxi people and to make sure that no one gets into a taxi without a mask, even if people are going to travel over 12 hours. We unfortunately, we are a province that is more than 1,000 kilometers from the economic hub of our country, just like Cape Town, and deliberately the both colonial and apartheid system saw the need to invest more to improve the system into other big cities like Cape Town. We've been making the point and arguing even to our national government that it must be appreciated that we might be peripheral to the center, but we are the center of the periphery.
Yeah.
We experienced these problems during this time, and we saw the huge underdevelopment that this has actually been subjected this province to, the levels of poverty which are caused by the underdevelopment. So we are working hard with the national government through the district development model to turn around the economic fortunes of the province, improve the socio-economic outlook of our province by implementing some critical catalytic projects that we have identified, that if we do this, some were planned as early as 1960s, deliberately were ignored, were never implemented, because this province must remain a labor-sending province. this province must remain subjected to the outward migration, which is affecting our equitable share, dropping everything that this province can work on to improve the situation of our people.
Let me interject there. Let me interject there quickly, Premier, because on this point of supporting the taxi industry, they are crying that, remember, the taxis are meant to transport people at 70% capacity. That means it's no longer 15 people, for example, that you would have in a taxi. It's now 10. And so economically, the owners of these taxis are saying they face the risk of their vehicles being repossessed by the banks. I'm stressing this point, Premier, specifically because if I look at a report this morning that suggests that 39,000 people that were traveling from the Western Cape alone were driving down to the Eastern Cape and were being ferried by the taxi industry. And the industry is saying, because of the economic situation we're in because of COVID-19, we are unable to provide the sanitization that is needed. At least 2 masks are needed for the taxi driver and the people that are going to be in the taxi, just for hygiene purposes, because it's a long drive of 14 hours from Cape Town to the Eastern Cape. Would you at least encourage the MEC of Transport, for example, in the Western Cape, Bonkosi Matigizela, to make sure that taxis that are leaving his province to yours are provided with the necessary support, PPE, that is?
No, definitely, yes. It's something that government should be able to look at that. We have done it here in the province. A number of taxi ranks that were visited during the first wave. We did supply the mask to our people when we were introducing the masks and making them mandatory. Well, it might not necessarily be true, but it's something that can be discussed. They can have their own cloth mask, which we are encouraging that they must have. But also they can, even if the cloth mask it will be too much for 14 hours, they can really be assisted. I think it's a campaign that the government, even in Western Cape, can look at it, because we must try to share this responsibility that we have to make sure that we protect more lives as our people are coming back home. We don't want those people to come and infect the families in rural areas, as we are busy trying to protect those families in rural areas. But we've encouraged our people that whoever comes away in your family, you must allow your own kind of a self-quarantine as you arrive home. Take some days looking at yourself so that you don't say that, no, I don't have a COVID-19, only to find that when you left Western Cape, you didn't have it, but you got it along the way. But wearing those masks, even if you wear them for 14 hours, they help to mitigate and minimize any chances of people who would understand that even if it's 70%, we might not have the 2-meter social distance that we're talking about as part of the non-pharmaceutical intervention. But at least if you have a mask, you are able to protect yourself and you protect other people around you. We have seen those masks working very well when we introduced them and we made them mandatory.
Yeah. Premier, very briefly, 2 last questions to you. We can't not speak about the economy in the Eastern Cape. You've taken the drastic decision, as you've said, that this decision was taken back in October, that you were going to close beaches. In this briefing, you've pointed out that factories are closing. Those are SMMEs. These are the very companies that employ the poorest of the poor. Are you not contributing towards poverty in your province by closing beaches? Why couldn't you have a similar situation that KZN has, for example, where on days that are not holidays, you open up the beaches and people go there and enjoy the sun and the beach?
First of all, let me just correct and put things into correct perspective. We are not in a lockdown. Factories are operating under very restricted arrangement. So factories that are going through this hardship, we are working with them. We have set up systems in our government to support those factories to ensure that we minimize as much as we can any loss of jobs. We have detailed kind of jobs that we have saved already, working with all the potential investors, and we have indicated that we have not lost any investor that has committed to invest in our province. especially those who were committing in the national investment conferences done by the president. They are now back on site. They are catching up with time. On the tourism, yes, to a larger extent, but our analysis has been that we knew that we will be reaching a peak of this second wave sometime in December. And we are targeting January that to get our people back. And we're looking at the 3 weeks period in particular, the last 2 weeks of December, knowing the massive inflow of people who will be coming all over. We know how our beaches look like from Mbizana, Mboti, Port St. John's, Mthatha areas, Coffee Bay, down here, all our beaches are full. And knowing the kind of capacity we have, of many people who have left better, good, big hospitals, tertiary hospitals in Western Cape and Gauteng, if they get sick here, when we know that the kind of capacity we have, we are managing it with the kind of people who have been in the province, we will have much more problems. So hotels are not closed. We are saying our people, many people who visit our cities, they are not all going for beaches. They are not all going for swimming. We have closed swimming, and people can move around and watch beaches and walk along beaches, but no swimming, because the problem of swimming, people don't have masks. So we are looking at all those big gatherings where people will not comply with non-pharmaceutical protocols. But if you walk around, you keep a social distance, you do this, and hotels are there. And we're saying in the Eastern Cape, we are not only having beaches as kind of a tourist destination products. We have a province being an adventure province. We have got Big Five, we've got all these beautiful landscape that the province actually is endowed with. And we remain that adventure province for all of you as tourists to explore. And this province remain yours to explore. So there's a lot on offer from a tourism point of view. Hotels are open. People can still book hotels, enjoy themselves, relax, try to get more energy to go back at work in January.
All right.
So that on its own is part of the mitigating.
All right.
Here, whether you open beaches on certain days or not, many people flock there, and that on its own is a risk, and those beaches are a potential super spreader. We've seen what has happened in KZN with that rage program of young people from Gauteng, plus minus 1,900 were all actually found to be positive of COVID-19 on their way back. So we can't allow that.
All right. Premier, it's clear you're not going to change your mind around the closure of beaches. Finally, Premier, you've had your own experience with the COVID-19 virus. How did you cope with it? Well, what did you experience? Take us through.
Yeah, well, that was a very difficult moment, I must say. 10 days, 14 days, going through, even though I tested negative on the 10th day when we checked it, but the repercussions or after effects remain because it's one thing, it's another thing that we've been exposed to. I've gone through this, but with the support of my family, support of South Africans, people of Eastern Cape, and people across the country, prayers, people sending all those, gave me more kind of an energy to face this. The difficulty with COVID-19, it literally isolates you from everyone. Even if you are isolating yourself at home, it takes you away from your family. Your kids are experiencing another experience of 10 years of not touching you, of not even getting closer to you. I don't want to say anything about their mother. It's obvious. But these kids cannot understand what this is going through. That's why my kids have been asking me a question, a 6-year-old, that, Dad, when are you finding the cure for this COVID-19? He believes that I'm supposed to be one who was finding the cure for this, and I'm keeping on explaining because they've gone through that experience. It's an experience that many people went through. All the 139 people who have survived this. So on your own, isolated, the issues of anxiety, the issues of panic in many people become an order, and many people lose more oxygen out of panic and anxiety, fear that normally goes with this. But it's an experience that I would not even wish for anyone to go through. That's why we are encouraging our people to fear the COVID-19. It is here. It must be felt. It's a fact. Avoid it. I'm not talking about people who have been affected. I'm talking about people who are infected, who have gone through the pain of not breathing well, gone through the pain of a throat that is so irritated, gone through every experience that you have never experienced in your life about how your body experiences, how your body changes to respond to this.
Premier, thank you very much for sharing not just your experiences with COVID-19, but the plans for your province. Thanks indeed for your time. The Premier of the Eastern Cape Province, Oscar Mabuyane.